Hello, everybody. My name is Chunzeng Wang. I'm a professor in Earth and Environmental Sciences at ANPI. Mostly I teach geology and GIS, and we have a GIS lab. This project is about GIS, and over the years, I and my students work on all kinds of GIS projects, of course, in addition to geology. So first, I thank the organizers for this year's homecoming, inviting me for this presentation, and also thank you for you to review this presentation. I really like the original personal presentation, so I could face audience, so that way we could be interactive, so I could answer questions, whatever questions about this Maine COVID-19 map. Now we have to do this pre-recorded presentation. Is kind of not that easy for me. I was not prepared for this kind of presentation, but anyway, I'll do my best. So again, thanks for inviting me, and thanks for viewing this pre-recorded presentation. So I will start how we started to create this map. Okay, so early in March last year, we all know, we all watch the news, and COVID-19 became issue in the US and worldwide, and soon it became issue in Maine. So in March 12th, Maine officially reported the first case, and so we switched to our attention from other states like California, New York, to Maine, because we started our first case. That could mean we would have more cases. So in 7 days, in 1 week, yes, we had more cases. So every day I was like everybody to pay attention to the news, what's going on in Maine. And I saw, found out Maine CDC created a website to create charts, maps, to publish the data. And also I soon realized probably I can do better to create a map, so I can use it, other people can share, and easier for everybody, of course, including the general public, and also including professionals like medical professionals who could easily get to the information they want, from just the one map. So that's how I started. So I made the first map, and in the same time, I communicated with our president, Ray Rice, and also our dean, Jason Johnston. So I told them about my thoughts about this map and how I was going to do it. It didn't take much time for them to understand what I was going to do and the possible potential influence. So then they approved this, let's say, a project as a project officially from ANPI's GIS lab. So it's not just my personal, whatever, my personal, it's ANPI's GIS lab that's going to do something. Because at that time, universities, organizations, whatever, we're all talking about what we can do to respond to this pandemic, right? And that's why I thought this is what I can do, we can do, representing ANPI, the university, to do something to serve the public. So I will talk about service, later on. So that's how we started. So I got approval, very quick approval permission from our president and our dean. So that was very much appreciated. So I know these two guys very well. I knew they were going to support this, and they have been supporting this effort from the first day to today, and for more than a year. So I thank them very much, for supporting this. All right, so I'm going to show you the first map I created. And here's the first map, dated March 20th. The very first map. And there you see, like Orange County, we had 0 cases. The closest is Penobscot, and that had 2 cases. That's just 1 week after the first case was reported. And also look at this, after the first case was reported, in 1 week, we had many cases, I would say, back to that time, in particular in like Timberland, in southern Maine, and in rural Maine, and only in like Penobscot had 2 cases, and Oxford, if we consider Oxford also real, 1 case. So that's March 20th, 1 week after the first case. All right, and the map was pretty simple. You know what? When I posted this map on Facebook, and the second day map on Facebook, there were 1,000 people that shared that map. 1,000 people. That was a kind of a surprise, but not that much. I knew this map would be welcomed by general public. So, so the second map, first map had more than 1,000 people to share. And the reason I used Facebook was, I didn't use much Facebook before. Only in recent years, I use it, for my like a class teaching field trips, like our GOE college club field trips. This is basically, to tell the public what we're doing here, right? And also to promote our programs. So that's what I was doing, using the Facebook before the pandemic. Of course, after this, my Facebook focus on this map update post every day. And when I started this, like in March 2000, year 2000, and I had less than 100 Facebook friends. And today I just checked that I have almost 2,400 friends, because over the last year, more than last year, every day I had people to ask to add to be Facebook a friend. So I could not do it 100%. It's basically 100%. I just accept as a friend. And of course, lots of people follow my Facebook page. And also soon, because it's in the beginning of the pandemic, there are all kinds of different stuff. And so a friend of mine told me there was a Facebook group, Dr. Shah's, fan of Dr. Shah, that group. And I soon realized that that group had a lot of members. So I soon realized that that could be another Facebook, page to post this virus map. So I soon became a member of that group, and to post this. And also soon this map became, and it becomes, probably the something for some people who wanted to join that group, right? In order to see this map. And of course, my Facebook is public, so everybody can see it. So that's the reason why we use social media, because social media is better than just a website. We all know that. It's easy to access from any mobile devices. So that's another reason we do this, and post on Facebook. And of course, Maine CDC website. This is today's Maine CDC website, but in the very first days, Maine CDC website was not as good as today's. And yes, they had charts, they had maps, but their website has been much improved, which is good. But even if you look at today's Maine CDC website, yes, they have publish, they release, update all kinds of data, like what I show you here. And the question is, how many people every day, have time to check a Maine CDC website to see all kinds of data there? And their data, of course, you don't have to know. And their data you really want to know, every time, every day you want to know. So lots of data, but lots of them are not that necessary, but they're data that's very necessary. You want to know every day. So I thought I could make a better map to include all the information we want to know on one page, and you can easily view it, with your cell phone, like that. And also other issues, not just the Maine CDC, Maine's, like CDC website, other states. Later on, I include our neighboring states, provinces, because this is, I learned from other people, the viewers, they want to also know other states. So that's why I later on added our neighboring states. I thought that's a good idea. I also realized that I could also include the information of other states. But you also look at the other states, including today, Maine CDC website. Like this is the most important chart that's updated every day for the new data release, including the cumulative. All you see here is just the cumulative. You look at this, you don't know how many new cases, reported today. Even today, you look at the Maine CDC website. But that's very important for us to know. We want to know how many new cases, right? From yesterday and reported today. Well, to find out, you have to do the math. You have to do the, the subtraction of yesterday's cumulative from today's cumulative. So you have to be good at the math. How many people are good at the math? How many people have this time to do this math? And also, like how many deaths from yesterday? How many people were hospitalized, yesterday? Because today's data is about the yesterday's, right? And you have to do the math. You have to do lots of math in order to find out. Even today, you look at the Maine CDC website, it doesn't tell you how many new cases. And the news agencies, TV, whatever, Bangor Daily News, other, and they have to do this mathematical calculation too, to report how many new cases, how many new deaths, how many new people, are hospitalized, like that. So, and of course, the Maine CDC doesn't have to do this. And if it does this, it would be better, but it's not necessary. For Maine CDC, like what it says here, this is just their data page, right? And first, their responsibility is to publish, to release the data. Of course, they do their best, to make a graphs like this one to show daily cases. So you look at this, you can see the trend of the pandemic in Maine, which is good, very useful, like that. But what if we have one map to include all this information, right? So that's big reason I wanted to create the map. That's probably also a question many people wanna know the answer. That's the answer. Okay. So so I show you the first map, and of course today is, you look at today's map where it says the 553rd day. That's from the first case reported in March 12th, 2020. And so this is almost the 550th map I have created. So over the last year, more than last year, every day The first thing I would do is to create a map. Last year, most of last year, the data was released around the noontime, like between 11 and the noontime. And because I work on a big geology project, some of you know I'm a geologist. It's my primary interest. And of course, the GS is also my very important job at INP here. We have really good GS lab. I teach GS course every year. So I have a good, large research project. I have to go to the woods, and people know I started my bigger project from Northern Woods, and now my project covers the whole Northern Maine. So I have to go to the woods. I have to do the field work. Like last year alone, I was out for 105 days in total. And partly because of the pandemic, partly because of the drought in Northern Maine, so I couldn't go. And partly because of my kids, all of them were gone to college or work, so I finally felt free. So I could go out whenever I don't teach, I don't have a meeting, and it's not raining, I go out. And of course, like last year, I had an MP student to be paid to be my field assistant, and I do this every year, for many years. So anyway, so last year the data was mostly released around the 11 noon time. So I decided to go to the woods early. So most of the time we left around 7:30. And Eric Bagley, he was my field assistant last year. We left early, so I could come back early in the afternoon to update the data. But this year, CDC changed the data release time, and the data is released around 8:16, somewhere between 8:16, 8:20 in the morning. So I know there's so many people in Maine, outside of Maine, they want to see this map as early as possible. So I decided to have this map to be updated, posted before I go to the woods. So what we did this year, and even now, is I would update this map and then go to the woods and then come home late. So just want to tell you more details about this. What else? And of course, soon after I start to work on this map, I got more friends, Facebook friends, including medical experts, people in the health care, like hospitals and nurses. These organizations, they always give me advice. I want to give two names. I always appreciate their advice and help. Every time I have a question, they give me answer immediately. And two names here: Dr. Eric St. Pierre. He's the director of the emergency department at Northern Maine Medical Center. So we keep communication all the time for more than a year already. So he's very supportive to this project. And also Dr. Dora Mills. And some of you know Dr. Dora Mills used to be Maine CDC director for more than 10 years. And she's now the senior vice president for Maine Health. And that has several hospitals in Southern Maine, probably the largest hospital organization in Maine. So she's also very supportive, and actually I know her. It's simply because of this map, and of course later we both learned my daughter, her daughter, all go to the same college. So anyway, it's all because of this map. I have made a lot of friendship. I got expert, help, including these two individuals. I appreciate their help very much. So I'm not just me doing this work. So I want you guys know, people know, I have people behind me and supporting me, not just the administration at the INP, and also medical experts behind me. Okay. And of course, from time to time, like through Facebook and Messenger. Oh, I never knew I would use Messenger so much so often. And I always have people using Messenger to message me, to ask questions, to give me advice. There's so many people I cannot name them. I just want to tell you, I'm not the only one, doing this. Yes, I'm the one doing this, but I have people, behind me. Okay. I take a lot of commands, suggestions, from users of this map. So I think that's how I started this, how this map, has been improved, like what you see today. So the programs, the software I use include basically ArcGIS. That's very popular, the most popular ArcGIS program used by GIS users. And we use this, the human system compasses, or teach ArcGIS. So this is the program, right? What you see here, that's the one I work every day to update the map. And also I use Excel, and that's where this actually graph is made. So I use Excel. You see the Excel now, I have 552 lines of the data. Okay, so from the first day, from when Maine CDC started to release data. So I have all the data here. And I have to tell you, there are other people who use this data to graph, to make some data out of this data. And from time to time, I have people to message me, to email me, to ask the data. So I just send them right away if I have time. I also have an email list. People don't know, they look at the Facebook, just like I said, I post it on Facebook, like my page, and also fans of Doc Sharp's page, and also residents of MSAD #1. This is our Prescott school district. They have a web page. I also post it there with their permission. And then I have an email list. And people don't know I have an email list. So after the map is posted on Facebook, I have an email list. I would also email the map to people included in the email list. And yesterday I got 3 people to ask to email this map to them. So if you know people who who are not Facebook users, but who want to see this map, let them know and email me or whatever, send me their email address. I could just, include their email address in the email list. It's just a one click, it will be sent away. It's very easy. Okay. And what else? All right. So because this is a homecoming, this is about our university. So I've been here for 16 years. So I see ANPI my home. People know me, know I care very much about our university. Very much, sometimes, people see me, I can be mean, right? People know me, know I'm outspoken. I speak from honesty, and because I really care about this university. I wanted this university to be more reputed, to be known by more people. I think, from this project, more and more people know ANPI, right? More and more people know, oh, ANPI can do something, right? We are a small university located far in the north, then so what? So we can do something that have impact on all manners, right? So this is what I tell people all the time. And of course, this is about community service. If let me show you the ANPI's web page, vision and mission. So mission. I'm not going to read all this page. I just want to, show you ooh, the battery is running low. Something is wrong. Why the battery is running? Oh, okay. So we serve our community and strive to engage all in activities that strengthen and sustain a rich and rewarding life. Okay, so every day in every way, it's about excellence for everyone. Then, of course, there are institutional values like supportive, responsive. From the beginning, I said that this is responsive. This is how we started this, how we respond to like a public, crisis, the pandemic. A visionary, innovative. Yeah, this is innovative. There are all kinds of things that people can do to help, but GIS, how many people know GIS can be such, helpful and a powerful tool, to pass the information to the public. Innovative and collaborative, like what I said, I have people behind me. I work with other people. They give me suggestions, like that. So this is our mission. Our mission is like what it says here, excellence every day. I'm sure everybody would agree. So this is about community service. And people know me, know I always work hard to do my best for community service, in particular like a GS. And AMBI's GS, I would say, is pretty well known for community service. Over the years, we have developed community service, a partnership with, like in Orange County, with all towns, major organizations, cities, at least in central Orange County, and including other towns in north and the south. So we have worked on many projects, sometimes I say hundreds projects. And some people would say, what do you mean hundreds projects? Yes, if you have time, you want to sit to talk to me, I can count one by one. So to me, that's very important. We are public university. We are a small campus, right? We are located in Orange County. So we needed to know there's a reason why we are here. And there has to be connection between us and the community. Otherwise, I don't think we can survive. I don't think we can get public, support. I don't think we can do well. So I know lots of our faculty here use their expertise, to work on projects and to do whatever, to benefit the communities. So I would like to see every faculty, and I know staff here, lots of them, and they are volunteers. They do lots of work, in the community. That's community service. So I want to see more people use their expertise, like me, use my GIS expertise to do something, to serve the public, the community. So I think that's very important. All right. I think I used a lot of time, and so I didn't think this pandemic could last this long time, and I'm kind of frustrated, and because it takes so long time, I don't see the light at the end of this. So that's why I said I'm frustrated. Then of course the issues, this is a public health issue. Then of course in the US, everything can become political, and that's really bad. And so this pandemic will continue. Even if we thought that we would have, we're going to have vaccine, then this pandemic would be ended soon. Yeah, for a while, we saw the light. We saw the end of this. Now there's no end, looks like. So I feel sad. I every day when I see the data released, it's like today, still, more than 700 new cases. So it's like, oh, come on, when is the end of this? So anyway, so that's my frustration, and but I still do my best, teaching, research. We'll see, and I will keep doing this project. I know lots of people use this. When I say lots of people, I mean not general public. I have emails and messages from public state agencies, and from hospitals, from nurses, doctors, because this map is not just for the general public. Even professionals, they use this tool because, like I said, they can get the information from one map. So I'm not going to say that much because there's so many people, they say all kinds of good words and praises on the Facebook page. All right. Again, thank you very much for inviting me to give this presentation. I really like the in-person one, so that way, you have questions, so you can ask me. We can, have the interactive, talk. But anyway, if you have any questions, you can email me or you use the Facebook, to message me. All right, thank you.